You may not realize it, but our skin is quite remarkable. It bends and folds when we move. It grows to fit our size. It can even heal itself. But stretch it too much and you have stretch marks, marks that do not go away. They can be erased, however, with a new technique Tappy Phillips explains.
It is remarkable, Roz, and even the experts don't seem to know exactly how it works, but those who've had it done say they have actually seen improvement. Now, more and more people are wondering if this is a new way to erase your stretch marks. Stretch marks. For years, they were just something you had to live with.
I've tried creams, I've tried many different things, and nothing worked.
Women get stretch marks during pregnancy.
28 is my oldest, so it's really something that had a long time.
Adolescents get them during puberty. Any rapid weight gain or even weight loss can produce them. Even men get them, especially bodybuilders.
The skin can't keep up with the excessive muscle growth.
They aren't painful or life-threatening, but wouldn't it be nice if they could be removed? Well, now a small and growing group of dermatologists is using lasers to reduce the appearance of stretch marks.
We'll treat this area over here.
Marlene Dinkin came to her dermatologist last week to have stretch marks from pregnancy treated. Dr. Joshua Fox is using a pulse dye laser to zap what is essentially scar tissue. The patient and doctor must wear eye-protecting goggles against the intense light. Dr. Fox has successfully used this method on birthmarks and just recently tried it on stretch marks.
So far, patients have had between 50 and 75% improvement, I would say.
The procedure was first popularized by Beverly Hills laser surgeon Dr. Adriana Scheibner.
By using concentrated intense light in a very gentle fashion, what I'm doing is stimulating the collagen in the deeper layers of skin to repair itself.
But there is some disagreement, even among doctors who are using the technique, as to its effectiveness. Different dermatologists use different types of lasers, and some use them in combination with creams like retin-A or alpha-hydroxy acids. And more importantly, clinical trials of the procedure are still underway, and results won't be available for perhaps 6 more months. The only thing patients have to go on now are the recommendations of friends and before and after pictures, which can be very misleading.
The photographs can be extremely deceptive depending on how the lighting is done. Their color changes. For example, the temperature in the room can change the color of the skin.
And almost no doctor will promise perfection. Can a patient expect to have a stomach like pre-pregnancy?
No. I wouldn't expect that, although we have had a few cases where they've responded very well. So that it's still too new. The jury's out.
There is some bruising afterwards, but the pain is minimal.
Well, it's almost like, I guess you have to show it. You just go like this.
Just a little
flick with your fingernail.
And even without hard scientific data, without promises of perfection, without any guarantees at all, more and more men and women are willing to try what appears to be an encouraging treatment to reduce the appearance of stretch marks. So was this worth it for you?
Absolutely.
Well, the cost of the procedure varies. Doctors we talk to charge about $400 to $500 for a pregnancy-scarred stomach, and the results of clinical trials are expected to be presented in the spring, and they should give us a much better idea just how well this procedure works.
As you pointed out, and this, as you mentioned, isn't just for women, men and women.
Men, absolutely. Quite a few men have them.
Great.